Hi, my name is Dr. Sayegh. I am an OB/GYN. When I was a kid and somebody was sick, I would go sit at their bedside. I'll get a Band-Aid and put it on their arm, even though they might have a flu. So I think I've always been drawn to that. And I see it a lot in my daughter. Even now, when someone's sick, she comes and sits at their bedside. And she brings her little doctor's kit that she bought with her own money. We never bought her that. And she would sit there and act like she's taking care of you. So I was like that. I remember being like that, especially my grandfather and my grandmother were ill when I was very young. So I remember sitting at their bedside and trying to take care of them and feeling very frustrated that I could not. There's always something about bringing a new life to this world. I don't care if I do it 100 times a day. It kind of makes your heart skip a beat. I always step back and think, you know, I want to treat the patient the way I want someone else to treat my kids, or my wife, or my family, or my friends, you know. So and I've lived by that. You know, you could take shortcuts on a lot of things, but then you step back and you say, you know, would I want anyone to take a shortcut on my family member or on my friends? And so I treat them like I think they should be treated. Well, we had this patient that for the longest time, she went through every OB/GYN around the city, and she was placed on every medicine you could think of, and they tried to get her pregnant. She wouldn't get pregnant. She came to me, and I mean, by far, I'm not going to take credit for this, but you know, we made friends. We tried a couple things, but I didn't want to put her through everything that everybody has put her through. At that time, she was going through college and, you know, trying to, you know, going through finals and all of that. I said, you know what, let's just stop. Let's take a year off. Go enjoy your life, go take a vacation after college with your husband, and when you come back, we'll regroup and sit down and think about it. Well, she came back next month pregnant, so on her own. I think a lot of the stress was, okay, I have some closure, let's wait for a year, we have a plan, and then when she came back pregnant, it was good. Get ready, because I'm gonna get into your personal life. I'm gonna know you as, I'm gonna know everything about you. I ask personal questions. A lot of my patients, when they come in, I know about their family, I know about their kids, so I have that common bond. I like to have rapport with my patients. And being in a small town, I'm gonna get to know everybody and everything about everybody. You know, everything stays in the room. It never leaves the room. I don't think anything that's spoken inside the four walls of the exam room should ever come out. But when you're in the room, I'm gonna talk to you like you're a friend, not only you're a patient. And I think in a small town like that, it's gonna be so much easier to accomplish that because there's not that big quantity of patients. So it's gonna be, I'm gonna get to do what I like, which is get to know my patients.